Welcome, everyone. My name is Julie Hayes, and I'm a member of the HEAL Data Stewardship Group. I want to thank you all for joining us today for the 17th installment in our Fresh Fair webinar series, Protecting Privacy in HEAL Research, a deep dive into data de-identification. This webinar will feature a presentation providing a deeper look into the de-identification process, including determining which data should be de-identified and appropriate de-identification methods. The presentation will be followed by a live Q&A session. If at any point you have a question, please feel free to type it into the Q&A box at the bottom of your screen, and we'll bring it up during the Q&A session. Next slide, please. Right, we are joined today by our presenter, Z. Z is a data privacy specialist and HEAL steward working within the Center for Data Modernization Solutions at RTI. He has over 7 years of experience working in data privacy. Prior to RTI, he worked at Privacy Analytics, a subsidiary of IQVIA, as a data privacy specialist, creating solutions for clients in industries such as healthcare, pharmaceuticals, advertising, technology, and government. He's experienced in data de-identification and anonymization, privacy impact evaluation, and privacy by design principles, and has performed expert determinations under the Health Insurance Portability and Accountability Act. He is an active holder of the Certified Information Privacy Professional United States certification from the International Association of Privacy Professionals. And with that, I'll pass it over to Z to begin the presentation.
Sounds good. Thank you, Julie. Good afternoon, everybody. So thank you all for coming to this webinar. The objectives for the webinar are as follows. So we'll start off with a quick summary of the previous webinar on de-identification. Then we'll move on to discussing the basis of determining what to de-identify within a data set. We'll also have a discussion around the legal requirements for de-identification under the HIPAA privacy rule. Then we'll move on to providing some guidance on determining the appropriate de-identification methods based on the guidelines of your institutions, the requirements of HEAL compliant repositories, and data types. And then we'll conclude with an explanation of the assistance that HEAL stewards can provide in meeting these de-identification requirements. So we'll start off with the summary of the previous webinar on de-identification. We'll be going over this fairly quickly because this will be only a high-level summary. I do recommend that if you have not seen that webinar, that you go to the playlist on YouTube to go and check it out. It does have some very interesting information inside of it. So in the previous webinar, there was actually a great example of de-identification using superheroes. Basically, we're talking about creating an illustration of a de-identification spectrum. Superman does not obscure his face. Batman obscures half, and Spider-Man obscures his entire face. So you can see through this simple example that, as you obscure more of your face, you are essentially de-identifying yourself more. However, I do want to go into a bit more detail about later on in this presentation about how this does not necessarily result in more protection. It really does depend on what you are trying to protect. In the previous webinar, we also talked about the two methods for de-identification under HIPAA, which are the expert determination and safe harbor methods. We'll be going into more detail about these two methods within this presentation. And finally, in that webinar, there was a discussion about de-identification methods, including suppression, generalization, perturbation. We won't actually go into too much detail about transformations of data to de-identify data in this webinar, as the focus will be on the motivation and thinking behind de-identification to establish a strong foundation for how you can approach de-identifying your data in the future. So moving on, I will want to start the discussion on how de-identification works by discussing the basis of determining what to de-identify in a data set. And I want to start off with this concept, the idea of hiding people in a crowd. Basically, the idea here is that the less you know about someone, the more easy it is to hide them amongst people who look like them. This is the basis of the formulation of various privacy metrics, such as k-anonymity, in which the number K is the number of people who look like someone based on what the information that is present within the data. Using the example of superheroes given before, you can think of it like this. When Superman takes off his suit, or rather he puts on a suit to cover his Superman suit, now that I think about it, and he puts on his glasses, he turns himself to Clark Kent. And with that, it is far easier for Superman to blend into a crowd than if he was still wearing that blue suit with a giant S on it. In contrast, like Batman and Spider-Man, even though they are obscuring their faces with their masks, they stand out within the crowd. But this is where the concept of what it is you're trying to protect really comes into play, because Superman is trying to protect his identity as Superman, so he has to cover that part up, whereas Batman and Spider-Man are trying to protect their identities as Bruce Wayne and Peter Parker. So the idea here is, by obscuring their faces, they protect their real identities by essentially making them faceless. It's the concept of it literally could be anyone behind that mask. So that's how they are able to hide themselves within a crowd, so to speak. Now, another concept I want to talk about is the idea that the risk of re-identification within a data set can never be fully removed. They can really only be managed. The only way to truly protect, fully protect a person's privacy from, if you're collecting data, is to not collect the data about them at all. There is always going to be a trade-off between privacy and data utility, because privacy protections necessarily result in the removal and obfuscation of certain analytically useful data elements. Within conceptually, we have this graph where we have what's called an acceptable trade-off curve. This is really conceptual. There's no quantitative measurements behind this, but the idea here is we want to be as close to this acceptable trade-off curve as possible to maximize the amount of privacy that you can possibly have, while also still possessing enough data utility for the data to be useful. In expert determinations, the expert who does the determination works with the end users to define what is useful, and they tailor the privacy protections to try to maximize this level of data utility. So when we're talking about these privacy protections and stuff, we always have to think about what fields are identifying inside of data. What makes a field identifying to a person? And to be an identifying field, it must satisfy three conditions. The field must be replicable, distinguishable, and knowable. What replicable means is that repeated measurements on the contents of this field are consistent over time. For example, something like biological sex, if you measure it once and then you measure that a week from now, there's a pretty good chance that the biological sex of a person will remain the same. Distinguishable means that the values in this variable can be used to tell individuals apart from one another. Using the example of biological sex again, you can use biological sex to tell apart males from females, hence why it would be distinguishable. There is a caveat, though, regarding distinguishability in that it does depend on context. For instance, if we have a data set where all the data subjects have testicular cancer, then biological sex may cease to be distinguishable because every single person inside that data set is expected to be male. Knowability is where things get a little bit tricky, though. And it's you can think of it as information that you can find either in public records or something that an acquaintance can know about a data subject. This really does depend on evaluating the context surrounding the data release, the kinds of information the end user of the data may have access to, or the kinds of information that someone who is trying to maliciously attack the data may have about the data subjects. So we'll get into knowability a little bit more in this presentation, because you can actually use it to further break down the identifiability of the fields within your data. So to evaluate how identifiable your data is, it would involve doing some classification on your variables. Basically, the idea here is, based on the three conditions of replicability, distinguishability, and knowability, you can classify your variables into different levels of identifiability. For instance, a variable that is that either fails either one of those three conditions will be classified as a non-identifier. If you have fields that do satisfy those conditions, you can further break them down based on the ability to identify an individual based solely on its contents or not. If that variable, just the contents alone, is enough to identify an individual, we will call that variable a direct identifier. Typical fields that fall into this category would be things like names, addresses, phone numbers, email addresses, social security numbers, as well as special codes that are assigned to individuals to be used for data linkage. If a direct identifier is present, the risk of re-identification upon your data set is automatically set to 1. Then if the fields inside your data cannot be used solely by themselves to identify a data subject, then we would look at those fields as quasi-identifiers. These are fields whose contents, in combination with other quasi-identifiers, can be used to identify a data subject. These examples would include things like sex, race, age, city of residence, occupation, medical conditions, and dates of events. We use quasi-identifiers to calculate group sizes to determine the risk of re-identification. That's when we're doing the k-anonymity measurements. That's how we determine that the size k within your data. Now, quasi-identifiers themselves can actually be further broken down into public and acquaintance quasi-identifiers based on knowability. If it's a field that contains information that can be found in the public record or data that can be obtained relatively easily by the public, then we will classify that as a public quasi-identifier. Sources of this information can include things like voter registries, educational directory information, white pages, social media profiles, newspapers. Typically, public quasi-identifiers are demographic fields, things like your sex, age, date of birth, date of death, things like that. Other kinds of quasi-identifying fields would fall into the acquaintance category, which is information that a friend, a spouse, a coworker, an employee, or relative may know about the data subject. Some examples include medical conditions, dates of events, and family structure. One thing that I do want to note is that certain variables that may not contain knowable information by themselves can be used to infer quasi-identifying information. One good example of this is provider zip codes. So essentially the zip code of your doctor's office is generally speaking accurate to patient zip code to about 3 digits. And this is because most people will not be driving, outside of a 3-digit zip code area in order to go see their doctor, unless it's, they're going to see a specialist across the country or something. Other things like prescribed treatments can be used to infer medical diagnoses, which can then also be used to infer things like gender and age. So when you're evaluating the fields within your data, you have to be careful, and you have to also look into what the fields that you have present could be used to infer for other kinds of identifying information. Now, when we're performing de-identification, the goal is to transform the contents of the identifying variables to better hide the individuals inside of a crowd. So what we're trying to do is essentially increase the group sizes, increase the granularity within the data so that a unique individual is not so unique anymore. Note that though, that this does not necessarily mean that we're looking at just purely group sizes within the data set itself. That's traditional k-anonymity, and it's a very strict formulation of this kind of privacy. Based on the type of data that you have, it could be, for instance, that your data is like a sample from a larger population, how you gather the data, the context surrounding the data release. It may be possible to look at group sizes in a broader context, like for instance, calculating the group size of that an individual belongs to from the entire population instead of the strict k-anonymity formulation, which, as I mentioned, is very restrictive and could have pretty severe impacts on the utility of your data if you are using that as your metric. Okay, so I want to move on now to talking about the legal requirements for de-identification under the HIPAA privacy rule. As I mentioned before, the HIPAA privacy rule recognizes two methods for de-identification of data. The first that I want to talk about is Safe Harbor, which is a rules-based de-identification method that calls for the removal of 18 different types of identifiers. Now, based on the classification scheme that I showed previously, we can see that most of these fields are direct identifiers, things like names, phone numbers, email addresses, biometric identifiers like fingerprints and voice prints, IP addresses. Those all fall into the direct identifier category. The main quasi-identifiers that are captured under HIPAA Safe Harbor are geographical references, which they want to be de-identified to 3-digit zip codes, and dates, which are kept at the accuracy of a year. There is a second condition under HIPAA Safe Harbor, which calls for no actual knowledge in the residual information that can re-identify an individual. Now, what does that mean? Basically, what we're talking about actual knowledge, it means the remaining information can be used alone or in combination with other information to identify an individual. When we want to look at it from two different perspectives. The first would be potentially external knowledge. For instance, if occupation is within your data, highly identifiable occupations such as the mayor of a city, governor of a state, or the president or CEO of a company would be something that you should consider for removal, because that can be very easily looked up and it is highly identifying. Things like publicized clinical events, such as major accidents that resulted in a patient's death, should be something that you should consider for removal as well as rare diagnoses. For instance, someone who has a disease in which there's only 30 people in the entire world who have, that would be something that you would want to consider removing. Then we also want to look at the knowledge that's held by the data recipients. And this is where things get a little bit tricky, because you have to know who your recipients are. For instance, if your recipient has a familial relation, a family member within your data set, it may be wise to not give the data to them, because they would know far more information about the data subject than you think they would, than you think a typical recipient would know. And so they may be able to re-identify someone based on a sequence of events that only they, as a family member, would know. And you also want to look at the recipient's ability to re-identify data. For instance, if the recipient has another data set that has identifiable information that they can potentially link to this data, then you may want to implement some controls to prevent that from happening. Now, in terms of expert determination, it involves having a qualified expert to perform a scientific and statistical evaluation to determine the re-identification risk. I have the actual text of what an expert determination entails from the guidance that's provided by HHS on screen right now, with some certain key areas bolded. But to summarize, in order to have an expert determination, you have to have the following 5 key points. You must have an expert who knows and uses a generally accepted methodology to perform this determination. And for generally accepted methodologies, these would be methodologies that have been published and peer-reviewed in scientific journals, or are already in use within industry to perform these kinds of determinations. So something like k-anonymity definitely fits. This methodology must include a risk measurement. And for the data to be considered de-identified, the measured risk must be very small. So that means that not only must this methodology include a risk measurement, but this methodology must also include the determination of an acceptable risk threshold, for which if the data that you do the risk measurement upon has a measurement value below this threshold, then it can only be considered de-identified. This determination must also evaluate the other information that a recipient could have access to, and that this entire process, the determination, the methodology, the expert who does it, the results, all must be documented inside of a report that you can, use as evidence. So if any one of these points is missing, then you don't actually have an expert determination. Here we have an example of what data de-identification using safe harbor and expert determination typically would look like. Safe harbor generally calls for deletion of data. So things like the name, month and day of a date of birth, the last 2 characters of a zip code, email addresses, medical record numbers, plan numbers. Those are fields that are typically redacted, completely deleted from the data set if you really want to follow safe harbor. With an expert determination method, there is a bit more flexibility in how you can de-identify your data because, again, it's based on a risk measurement that is conducted by an expert. For instance, things like direct identifiers like email addresses, medical record numbers, names, things like that. Instead of complete deletion, you can use things like random replacement. Like, for instance, you can replace the name John Smith with Robert Wang, which is pulled randomly from a database of similar looking names. Of course, like the method by which you replace these fields still needs to be evaluated by the expert and to be clear, to be determined as, oh yes, this is completely random, so this is okay. So that's something that still needs to be done, but you have this extra flexibility. Otherwise, things like dates and such, you can potentially keep a lot more granularity based on the expert's measurement. And you can use things like date shifting to maintain the structure of the date while also being able to add noise essentially to the value itself. Okay. So moving on from that, I want to provide some guidance now on determining the appropriate de-identification methods that you should be using in order to submit to HEAL compliant repositories. And there's a couple of questions basically you should be asking in order to do this, in order to figure out what it is that you should be doing. First question, are you collecting or generating human subject data? For the HEAL compliant repositories, if you are collecting human subject data, then de-identification is almost always required. If you're not, for instance, if your data is based off of mouse genomes, there's nothing to de-identify, so you don't have to worry about it. You also want to look at where your human subjects are located. State privacy laws may apply to data that you gather. For instance, there's new genetic data privacy laws coming in from Alaska, Illinois, Delaware, Florida, Georgia, you name it. There's a whole bunch of different states that are currently that either have a genetic data privacy law or are in the process of implementing one. Typically speaking, most HEAL investigators are collecting health data. But if you are collecting data that falls outside of health data, that would fall under consumer data, then the consumer data privacy laws may come into play as well, most notably things like CCPA from California. Data obtained from overseas may fall under the privacy regulations of different countries. In particular, collecting data on European data subjects, that would fall under GDPR, and there are extra complications regarding transferring that data out of Europe, for instance. We would highly recommend that you consult with your IRB or privacy legal counsel to navigate these kinds of difficulties that may arise. Another question you should ask would be, what are your institution's requirements? Does your institution have a policy in place to provide, or do they provide guidance or resources for de-identification? And finally, you also want to look into what are the requirements of the repository that you wish to submit to. Your institutions themselves, from what we've seen, many institutions have a specific set of rules that you must follow to de-identify your data set. For instance, a lot of institutions say that all health data must be de-identified according to HIPAA Safe Harbor. So, do that. Your institution may also have de-identification resources, such as a team to perform these kinds of expert determinations, or they may have specific tools to use. There's resources that you can consult within your institution would be like your data governance and data privacy office, your institutional review board, library services, and if you really need legal guidance, the Office of General Counsel and Privacy Legal Counsel. And before you submit to any repository, you should definitely check the de-identification requirements for the repositories. For the HEAL compliant repositories, they generally fall into 3 categories. Either it's a rules-based method, such as HIPAA Safe Harbor, or you must conduct an expert determination or a similar process, or they have a custom de-identification requirement as defined by the repository themselves. We are actually constructing a web page that will be put up at healdatafair.org that has high-level summaries of the de-identification requirements for each of the HEAL compliant repositories at this time. But of course, if you want further details and specific questions about what to do with your data, we do recommend that you contact the repositories themselves for them to provide that guidance. So what can we as HEAL stewards provide for you to help you through this process? Essentially, there's 4 different things that we could do. We have the identification resources, like the website that will be put up, which we could direct you to, and we could provide some high-level explanations of the requirements for each one of the repositories. And we can provide some detailed guidance as well for how you could potentially meet the requirements for de-identification, although we do recommend that, after listening to our guidance, that you also check in with the repositories to make sure that is okay. One thing that we are building capacity for would be reviewing data dictionaries to help identify the fields that may need de-identification. Essentially, that will be following the classification methods that I talked about previously in this webinar. And of course, we also can provide assistance with other kinds of sensitive data, such as data about substance abuse victims, data for American Indians and Alaska Natives, and things like that. There will be further resources that will be put on healdatafair.org when those resources are ready and fully developed. All right. So in summary, today we were able to discuss the basis of how to determine what to de-identify within a data set. We discussed the legal requirements for de-identification under HIPAA. We also provided a guide for obtaining assistance for de-identification and gave you an overview of the de-identification assistance that HEAL stewards can provide. Moving on to the Q&A session.
All right, great. Thank you so much for the presentation, Z. I will now invite our Q&A guests, Dan Janes of NIMH Data Archive, Vivian Ota Wang of NIH, Amy Pienta of ICPSR, and HEAL stewards Ali Gartland-Gray and Rashonda Lewis. If everyone will please turn on their cameras, we'll now stop screen sharing to begin the Q&A session. All right, great. And we have our first question. So NDA uses a global user ID. Could you explain a bit about this and what implications this has for researchers submitting data to your archive? And this is for Dan.
Yes, hi, this is Dan Janes. I'm the program lead for the NIMH Data Archive, also known as NDA. And it is expected that researchers will contribute their data to NDA, associating their human subjects with a global unique identifier or GUID. And what we do is we transfer a script to researchers who want to generate a GUID with which to associate their human subjects. The personally identifying information needed to generate a GUID is first name, middle name, last name, sex, date of birth, and place of birth, municipality or city. Those details are typed into the script that NDA provides, and a randomized hash code is generated that can be assigned to each human subject for submission to NDA. So no personally identifying information is submitted to the archive the data are submitted in association with the GUID. There are some researchers that cannot generate a GUID because they're working with human subjects that are no longer available to them. They can't ask for those specific details. Some human subjects are not willing to provide those details, so a GUID can't be generated. In that case, the researchers contact NDA staff, explain their justification, and a judgment is made. If we can allow it, we'll allow researchers to use a pseudo GUID, which is not linked to those personally identifying details in any way. So the difference between a GUID and a pseudo GUID is that with a GUID, research details from more than one project can find each other in the archive, making that human subject's information more valuable, making a larger set of data. A pseudo GUID cannot link to anything else. It's just kind of a gibberish code. So pseudo GUIDs can be sent to the user to be put in place of GUIDs. And if researchers find those necessary details for GUID generation later on, a pseudo GUID can be graduated to a GUID, or the data can just remain in NDA in association with pseudo GUIDs.
All right, thank you so much, Dan.
Sure.
All right, next question. What is ICPSR's role in the HEAL data ecosystem? This is for Amy.
Thank you. Welcome, everybody. For those of you who don't know ICPSR, we are a data archive located within the University of Michigan. ICPSR itself is an international consortium of universities, academic institutions, and other research organizations. And we've operated a data archive for 60 years and are part of the HEAL ecosystem, offering our repository services. We also host 3 NIH-funded data repositories, one for the National Institute on Drug Abuse, one for the National Institute on Aging, and one for NICHD, the Child Health and Human Development Institute that focuses on population data. And so as part of those repositories, relevant HEAL data can be shared, and there's support for archiving and making available those data sets. Again, drug abuse, aging, and child health and human development. ICPSR can offer assistance with other HEAL data that don't fall within the realm of those 3 repositories as well, in different situations. One, if funds are provided to ICPSR, or ICPSR itself selects the data and offers services around the data. ICPSR and the HEAL platform are working on connectivity so that any data at ICPSR can be accessed via the HEAL platform. And that connectivity is coming by the end of summer.
All right, thank you, Amy. Okay, next question. It seems that risk would not necessarily always equal 1 for names, as 2 individuals may have the same name. Also address, as more than 1 person can live at the same address. And Z, would you like to take this one?
For sure. So the reason you are right, in the sense that there are many people who have the same name. Goodness knows how many John Smiths there exist inside the world. And you're also right in the sense that, within a typical address, we're looking at an entire family instead of just an individual. When we look at direct identifiers in that way, we are taking a conservative approach to the risk measurement. So while yes, it is true that there are many people who have the same name, there are also people who have very unique names. For instance, my name. And because of that, it becomes very hard to treat a field like names as something where, you can do a very granular risk measurement on, just simply because there are so many people that do have unique values within those kinds of fields. And so taking the conservative approach, we would say that names are directly identifying because, you can identify a person based on what their name is. And that is typically the approach that is taken within, different legal frameworks as well. For instance, even under HIPAA Safe Harbor, names are something that you have to remove because it's something that is considered directly identifying.
Great, thank you. All right, next one. How do we balance the need for de-identification with the need for sufficient detail in the data for research purposes? How do we balance the need for de-identification with data sharing? And I'll direct this to Vivian.
That's a great question. And I can say that there's not a one-size-fits-all formula for that. This balancing in part is specific to the studies, and I think the HEAL Initiative has really spent a lot of time looking at these specific issues. The pieces I would like to emphasize as you start thinking about how you as researchers or the initiative are going to determine the factors that will need balancing is to ensure that as you make those determinations, you don't assume anything. Each community has its own concerns, and you just need to ensure that those voices are included in your decision making. Part of the issue of the needing sufficient detail in the data for research purposes is you need to account for the human factor in the research and the data. And that human factor gets translated into individual and community, the potential risks for identifiability and stigma that may not necessarily be that obvious to researchers or the database or repositories. So because of that, I think that we need to take particular attention and care when we start thinking about that balancing, that we not only look at the value of the data for its research purposes, but to realize that the data really has people behind it and people who live in communities.
Great, thank you so much. Right, next question is, what kind of assistance can the HEAL stewards provide for other types of sensitive data? Now I'll send this to Allie.
Thanks, Julie. So Z sort of touched on this in his presentation a little bit, but the stewards are working on developing an array of different resources and guidance for HEAL investigators, collecting a variety of different types of sensitive data. So stay tuned for that. Hopefully we'll have some of that information up soon. And in addition to those resources, we're also happy to meet with anyone to provide individualized consulting services on a variety of topics. So, you know, sensitive data, of course, but also repository selection. We can try to help provide guidance with curation and data management. So be sure to reach out to us if you're interested in our assistance. And you can do that via the Connect with Us form on the website, and we will make sure to get you connected with the appropriate subject matter expert that can help.
All right, thanks, Allie. And next question, the types of data and amount of data used in research keep growing. How does this impact the requirements and role of de-identification in research data management? I'll direct this to Rashonda.
Yeah, so we're in this era of big data, with data being generated in real time from all sorts of sources. We've got wearable devices, computers, electronic medical records, and our ability to integrate these data into larger databases is also growing. But at the same time, patients and consumers still have a high expectation that their data will be protected. Our laws require it. There are new laws coming online that are creating more robust protections for consumers and patients. And our ethics also require that we continue to protect privacy. So given that, and then this the parallel need for researchers to have access to data to do their good work in critical areas like pain and addiction. The role of de-identification, I think, is and will remain incredibly important.
Thank you. Next question, is de-identification still necessary if a very thorough informed consent form has been developed and signed? And this is open to anyone to answer.
I can take a shot at that. At NDA, in order to use the archive, you need to have an NDA account, and in order to have access to the data resources at NDA, you have to submit a data use certificate, which is co-signed by your institutional official. So someone is accountable. That is one of our major protections for de-identification, is to let people know that there is a consequence for misusing the data. The allowable uses of NDA's data resources are defined on the archive's website. And if the data are misused, large institutions can be held financially responsible by NIH. So that's part of what can be said in terms of need for informed consents and de-identification. One of the major protections in here is not only adequate de-identification, but an enforcement policy that does have some teeth in it.
Thank you. And next one, how do different repositories vary in their de-identification requirements, and how does one navigate this variability? And I'll send this back to you, Dan.
Could you repeat the question again, please?
Sure, no problem. How do different repositories vary in their de-identification requirements, and how does one navigate this variability?
This is a really tough question. There's opportunity for innovation here, is what I would say. This sounds like a large R01 project to me, that if someone can find a way to melt together data from different repositories that have de-identified in different ways, that would be extraordinarily useful. And this is still very early days for that. So in short, I don't have a great answer.
I can also jump in and just add that on the, on our end for HEAL Stewards, this is also something Z mentioned in his talk, but we're also working on compiling that information for the HEAL compliant repositories. So for at least on the data submitter side, we should be able to provide that information for each of the HEAL compliant repositories. So that should make it a little easier to navigate for at least HEAL compliant repositories, but of course doesn't solve the problem for every repository.
Great, thank you. All right, next one is, what if sensitive information was accidentally deposited? Do repositories allow edits to be made in data already deposited? And I'll send this one over to Amy.
Question. We certainly have encountered this in our archive. Occasionally sensitive or disclosive information arrives. When that happens, ICPSR staff are in contact with the investigator who deposited the data to describe what we found. And then there are sort of two courses of action that might ensue. So one, we would, if the investigator was willing, ask them to alter the data, edit the data themselves and resubmit it, or ICPSR itself offers to make those data edits with the agreement of the investigator who deposited the data.
All right, great. Okay. All right, so we have a long one here, but going back to the root of the de-identification / re-identification problem, what are the statistical estimates of the risks and adverse effects stemming from PII breaches? Is there data on how many breaches of PII have occurred in the past and how many have resulted in adverse effects for individuals? How does the real world rate of impact on the individual compares to the risk of re-identification? Would just establishing tighter IT security for data repositories and data analysis environments be sufficient? And a follow-up question, would that be a matter of proper punitive legislator mechanisms that would protect individuals from attempt of adversaries to cause any adverse actions against them? The risk of adverse effects of PII breaches by foreign adversaries may not have significant impact on individuals. And I'll send that to Z.
It's a lot of questions in one. Okay, so I'll answer them in order. Estimates on the risk and adverse effects stemming from PII breaches. Less so estimates on the adverse effects, but in terms of estimates on the risks, those do exist. Can't quote any off the top of my head, unfortunately, but there have been studies that have been performed on essentially how likely it is for a breach to happen. Typically speaking, within the industry, we're looking at, if you have a strong amount of protections in place, you have basically a 14% chance of being breached. If you don't have strong protections in place, you're looking at a 27% chance of being breached. And I can look up the study and provide that to you. It may take me a little while, but I'll try to find where those numbers came from. In terms of establishing tighter IT security for data repositories, I mean, it helps. But again, we are currently living in a situation where every single computer system, particularly ones that hold sensitive data like health information, are constantly under attack. It's not a matter of if it will be breached. It's not a matter of how much protection you put into place. It will really only delay the inevitable, in a sense. Right now, within the privacy protection world and within the IT security world, we're already not even saying it as if your place is being breached. It's when it's going to happen. In terms of punitive legislative mechanisms like laws and stuff, those are already in place. We have HIPAA has very strict requirements for the kinds of protections that need to be put in place, and breaches of privacy, like personal health information, personal identifiable information. There's a lot of laws already in place about what happens if those do get breached. It hasn't stopped the adversaries. So basically, there has to be additional protections put in place at the data level itself to try and protect this data beyond just what we call the security controls that are in place. Now, as for breaches by foreign adversaries, that's up for debate whether such a thing would have a negative impact on the individuals. But legally speaking, if you do suffer from a breach as an organization, there's already enough consequences in place that you really don't want it to happen. So basically, the idea here is to protect your data as much as you possibly can, and that it would include the kinds of security controls that you are talking about with IT security, as well as controls upon the data itself. And if anyone else wants to jump in and speak more on this topic, please feel free.
I might just add a little bit of repository comment to Z's excellent answer, which is to say that just for a sense of scale for the audience, ICPSR probably has over 1,000 restricted collections that have at least indirect identifiers and some with some sensitive information that we've been managing access to for 15 years. And over that time period, we've had protocol violations, so data users who might violate how we expect them to behave with the data and do things with the data, but no PII breaches stemming from that. I do think that there is a lot of value to the work that repositories generally do to mitigate the risks of the files, to provide secure protections around them, and for the funding agencies that we are working with, these kinds of answers that both Z and this question asker pointed to, which is we do have a lot of that very relevant security requirements around the important and sensitive data sets of NIH.
All right, thank you both. Next one is, are there specific considerations or guidelines for de-identifying data from specific groups or populations? And I'll send this to Vivian.
Yes, and I guess I want to put some structure around the question. The first one is when you were talking about de-identifying data from specific groups or populations, I think it's going to be important to define what is the definition of the group or population, and what are the parameters for that definition, and who is actually designating this particular group or population as needing specific considerations. Because there may be a researcher perspective that may not see the importance of a specific consideration, but the lived experience of the community or the individuals may be something else. So I think that's a question that doesn't get asked enough, that should be put as part of the sort of inquiry matrix. Similar to my other answer, I think that you can't make assumptions, and that you need to really think about certain groups. So, for example, at the National Institutes of Health, we have had a fair amount of experience working with some communities who feel that they need and require additional protections. So, for example, there are some tribal nations that feel that because of either community or groups potential increased group stigma, there need to be additional protections. What some of those communities have decided is they want the data aggregated in some way as a way to as a first step of de-identifying them. It should be noted that some other communities feel that's not enough. So part of it, I guess you just need to ask, and you can't assume, because as you as a researcher don't seem to identify a specific group of needing specific considerations, it's always worth asking, because it may not be related to demographic variables or lived experience, but it could be due to different phenotypes or the stigma that is related to the particular condition. I do want to make a note that there are differences in how you actually develop specific considerations. So, for example, if you're working with a designated tribal nation, you really need to go through the formal processes of not only of community engagements, but doing the actual negotiation, which is a legal expectation with the appropriate tribal leaders, because you will actually need to do that extra step of truly clearly defining the data transfers and use agreements, as well as data ownership.
All right, thank you, Vivian. Next question is, have you ever used synthetic data generated from real data? And do you think that synthetic data will be used more in the future? And this is open to anyone.
I could probably provide a quick answer. So we have looked into using synthetic data as a method for data de-identification and for providing public use data sets for researchers and the general public to access and analyze. One thing that's to note regarding synthetic data, though, is that so there's two things to know. So first off, the synthetic data itself, to make sure that it is you're producing synthetic data that is not identifiable, you have to take a look at the method behind how it is generated and measure essentially how close the generated data is to the original data. There's a couple of different metrics that you can use, but typically speaking, we're looking at various kinds of distance metrics and doing some kind of measurements based on those in order to determine that your data is sufficiently different for the data to be considered de-identified. The other thing to note, though, is that synthetic data sets, the analysis that you get, the analytical results that you get off of synthetic data sets may not be reflected in the real data itself, because to synthesize the data, you're essentially performing an analysis upon data that was created by a model that did some analysis on the original data to create this fake data. As such, I would say that there are specific use cases that synthetic data can definitely satisfy. The most notable one is providing essentially a test bed for researchers and analysts to perform their initial analyses to ensure that the code that they're producing, for instance, will run on the real data, but do not take the results that you generate off of synthetic data as gospel. because it may not actually be true when you run it on the real data.
All right, thank you, Z. Next one is, do repositories generally screen data deposits to look for sensitive data /PII, or is it the responsibility of the data submitter to ensure that no PII was included? This is another open question.
I can take this. For NDA, the answer is both. We do have validation tools that users can use to screen their data as part of a quality control effort before submission to NDA. But it is the responsibility of the user to screen PII out before submission. So for example, if users are contributing transcripts of interviews or focus groups, it is expected that those transcripts will be scrubbed of PII before submission.
Great, thank you. And last question, do you happen to have information on what an average budget is for utilizing a repository's de-identification services? Does NIH DAP/ICPSR offer de-identification services as part of the archiving process? Is there an extra fee for this? And I'll direct this to Amy.
That's great. That sounds like me. For this question, the NADAP archive that I mentioned was funded by NIDA, that's referenced in this question, and some of the other NIH repositories offer the de-identification service, or at least the verification of de-identification, where there'd be no cost to the investigator. That's providing that that the data meet what that archive agrees to take, and in some instances there's NIH approval on what data that archive will accept. So that's one caveat. For any other data falling outside the scope of these established archives, our curation service for a typical data package is just over $13,000. However, that's always just an estimate. It's a little bit more used for those who are putting proposals together. And really, we're able to determine an actual cost for our services that may either be more or less than that, which would depend on the size and complexity of the data collection. And when I give you that number, it sounds kind of big, but we don't really separate de-identification from our other curation services. And so that dollar amount covers disclosure risk and review, mitigation, and other tasks that we would apply to the data and documentation to make sure that the data were accessible, fair, reusable. My answer.
All right, thank you so much. All right, thank you again to our presenter Z, as well as our Q&A guests, Dan James, Vivian Ota Wang, Amy Pienta, Allie Gartland-Gray, and Rashonda Lewis. We are very grateful for your insights. In addition to our presenters and panelists, we would like to acknowledge the behind-the-scenes team listed here who worked diligently to bring this webinar to production. Next slide, please. Sorry, next one there. Yep. All right, and thank you to the audience for your participation in today's webinar. We hope that you are leaving with a better understanding of data de-identification in HEAL research. In addition to a recording of this webinar, we will also email everyone who has registered a list of resources that will assist you as you participate more deeply in the HEAL ecosystem. This slide deck will be shared, and a link to our Slack channel and Connect With Us form will be located in the chat. We hope that you will reach out to us, the HEAL Stewards, for questions or support as you embark on your FAIR journey to maximize the value of HEAL data. We look forward to seeing you at our next webinar on Thursday, July 20th at 1 p.m. Eastern Time, which will focus on HEAL best practices for preparing data for publication and dissemination. Finally, we are excited to promote the next HEAL Connection sharing session on Thursday, July 27th at 1 p.m. Eastern Time. You can find the bit.ly to register on this slide, and the full event link is located in the chat. Thank you again, and have a wonderful afternoon, everyone.